ICMR issues guidelines for healthcare of persons with disabilities dated 11th June 2020. Comprehensive guidelines were issued by Indian Council of Medical Research ICMR for healthcare of persons with disabilities against the backdrop of novel coronavirus and protocols to be followed. ICMR's directives address concerns that healthcare machinery was not walking the extra mile while attending to PWDs, despite the fact that they needed extra care and precautions. The 71 pages directives have taken note of all the possibilities and came out with the guidelines after detailed study of current practices worldwide for healthcare facilities and special needs of PWDs. Earlier, in absence of any specific directions, activists working for welfare of persons with disabilities were aghast at sorry state of affairs that handicapped persons faced, especially in COVID-19 facilities. An important aspect about ICMR guidelines is its Nagpur Connects, a city-based NGO, Mission Institute for Training, Research and Action, Mitra, took up the issue about shortcomings in healthcare facilities for PWDs who have tested positive for COVID-19. Several other groups in the country also apprised the central agency, following which a team of experts was constituted who, after detailed study, came out with the point-by-point guidelines covering various aspects relating to PWDs, the caregivers and other issues, said Abhijit Roth, President Mitra. One has to be very patient while dealing with PWDs, especially persons who are mentally challenged, and in light of novel coronavirus with paramedics and doctors under severe stress, one could hardly find empathy in their dealing with such patients. These patients need to be in a familiar surrounding or in a care of persons within the family, and since there were restrictions on presence of non-COVID-19 facilities, that complicated matters. Now that ICMR has allowed presence of even non-COVID-19 patients with PWDs in COVID-19 wards, the issue stands resolved to a large extent. It specially recommends presence of mother or any other caretaker with PWDs, especially those having intellectual learning of multiple disabilities. Some of the salient point of the recommendations made by ICMR has laid emphasis on presence of people engaged in rehabilitation of PWDs along with doctors and nurses. At hospitals and dedicated treatment center, all the facilities like ramp, lift and reserved seats be kept, and it is to be ensured that Even items like crutches, wheelchair, and other equipments of PWDs should also be sanitized and be made part of protocol. The guidelines lay emphasis on easy accessibility of all the facilities, including machines for PWDs. For persons with hearing or speech impaired, trained personnel knowing sign language should be present and they be given all facilities at par with other general personnel. Transparent masks be utilized while dealing with such persons, as traditional masks may lead to miscommunication. Similarly, one important instruction for healthcare personnel is to avoid communication and stress be given on written messages. For blind and low sight persons, the instruction be issued loudly and clearly, and braille literature be utilized to convey the messages, and preferably in local languages. The machines that would be used should be continuously sanitized. Further, ICMR suggested usage of various colors, charts, pictures, cartoons to reach out to PWDs at large while they are under treatment for COVID-19. District Social Welfare Officer services should be utilized to help. Crutches, wheelchairs, hearing aids, and other such items must be kept for usage for PWDs while in isolation of quarantine facilities.